Guys, I have realized that so many people are suffering from anxiety disorder. Anxiety has become a big issue, a problem, a trouble in so many people's lives. Actually, I have received so many questions in my inbox, comment section, people asking about how can I manage anxiety. Even in my sessions, I have handled so many clients, yeah, complaining about anxiety, and I thank God that I have been able to help quite a number of people to manage anxiety. So today, allow me to talk about anxiety, to define it, what are the symptoms, even effects, and even how you can manage anxiety disorder. And so let's go. So maybe you may ask, what is anxiety? Anxiety is that uneasiness, an uneasiness caused by fear, worry, and nervousness because of something uncertain in your life. And anxiety is normal, actually. It's normal to have anxiety about maybe an interview, an exam, or maybe a task that you are about to do. But when anxiety becomes disproportionate or not proportional, when anxiety becomes overwhelming, constant, disturbing, at that time now, it is a disorder that interferes with your daily life. So that's why today we need to talk about the anxiety disorder. Now, we have two broad categories of anxiety. And as I've said, number one is normal anxiety. We need anxiety in life. Without anxiety, you cannot rush to arrive early at workplace. Without anxiety, you cannot prepare for the exam. Without anxiety, you cannot prepare yourself for the date, yeah, for the first date with your crush. So we need anxiety in life. But again, now we now come to the second category, which is now the anxiety disorders. And we have so many types of anxiety disorders, but generally it is when your life, you cannot continue with your life normally because this anxiety has become too much. Be it the GAD, that is the general anxiety disorder, be it the social anxiety, and so many other forms of anxiety, which we are going to be looking at. But generally, we have two categories, the normal anxiety and the anxiety disorders. I believe that you'll be having questions as we continue. You can write down a comment or a question. I'll be answering in the next videos, and I believe we are going to be doing well. So let's now come to what causes anxiety. Because so many people have been asking, what causes anxiety? Where does it come from? And number one culprit cause of anxiety is biological factors. Biological factors are in two. Number one is inherited factors or inheritance. You may inherit anxiety disorder or problems with anxiety from your parents. Yeah, it is in your genes, it is in your blood, it is in your chromosome. So you are already predisposed to be anxious or to have the anxiety disorder. But we are going to come to management, how you can manage that. Also, in biological factors, we have the brain chemicals, the imbalance in brain chemicals. We have brain chemicals that are responsible for mood, for fight and flight. For example, for mood swings and changes of mood, we have serotonin. So when serotonin is in low amounts, or you have low serotonin, you're going to have troubles regulating your mood and resting. You'll be having issues with restlessness. Also, we have another chemical called GABA. GABA is gamma aminobutyric acid. It is the one responsible for flight and fight. So when you have low gamma, or gamma is in low amount than the threshold required, you'll be suffering from being hyperactive, or being so too much active, So even overreacting, all those things are going to be happening. We also have so many other chemicals like dopamine. Dopamine regulates motivation and things like that. So the first cause of anxiety disorders is biological factors. And then from there, we also have emotional factors. Emotional factors may be you went through a trauma, a traumatic experience, and that trauma has been causing you anxiety. One of the major traumas in life is loss of a loved one. And there are three losses of loved ones that are very dangerous and that can cause anxiety in your life. That is the loss of a child, of your own child, loss of a parent, maybe your mother or father, or a sibling, or a family member, close family member, or even loss of your spouse, husband or wife. That is trauma. And also, as we talk about emotional causes of anxiety, also some people suffer from perfectionism. Perfectionism, there are people who feel like when something is, they need to be perfect. Whatever you are doing, you have to do it so well. So when you miss a little bit, you feel so much anxiety. Or when you're just about to undertake a certain task, you have put so high expectations for yourself. So when you're not able to deliver, you feel so much anxious. So all those are causes of anxiety. We have talked about biological factors. We have talked about emotional factors. We also have environmental factors. Environmental factors could be at school, work, maybe there are stresses coming from your school, from your work, from your academics. We also have financial issues, especially debts. When you have so many debts, you are not able to pay, so many people are asking you for their money, you have not paid, or maybe creditors, they are calling you, texting you every other time, or you don't have money for food for your family. Anything financial can cause you a lot of anxiety. Then we also have relationships. We are still at environmental causes. We have relationships. Could be your marriage, could be your relationship, you are dating someone, could be a normal friendship, could be boss, employee relationship. Anxieties can crop up from relationships. Yeah, maybe there are misunderstandings in that relationship, or some tensions, or anything that is making you feel you are uncertain about the future, or there's a heartbreak in that relationship. All those things can cause anxiety. We also have lifestyle factors that can cause anxiety. Could be you are using drugs, maybe drugs can cause also anxiety, and other things like you are not sleeping well, you are not eating well, and other lifestyle things that may bring about anxiety. So now I would want us to look at symptoms of anxiety. How do you know that you have anxiety disorder? Very important. How do you know you have anxiety disorders? Let's start with physical symptoms of anxiety disorder. Number one is headaches. You may be having constant headaches that are not going away even when you sleep. You sleep and you wake up and you find the headache is still there. When you try to manage the headache with the drugs, maybe you can take painkillers, the headache might go away for some few seconds or minutes or maybe 1 hour, and then it resurfaces. When you go to hospital, there is no medical diagnosis. There's no medical reason why you have a headache. So those headaches, then we also have racing heart. Your heart begins to race. Racing heart. We also have shortness of breath. Sometimes you may feel like you're not breathing, like your heart is not pounding. Also stomach aches, which have no medical reason. Even when you go to hospital, you are tested, there's nothing, but you have stomach aches. You also have sweating. Some people even sweat. They sweat profusely. Some even sweat. You may even change clothes 2 to 3 times a day because of sweating. Also trembling or shaking or shivering. All those are physical symptoms of anxiety. Also fatigue. You feel tired, yet you have done nothing. You have slept the whole night, but in the morning you wake up, you are so tired because your brain was still at work. Your brain was still overthinking. You have racing thoughts. Those are physical symptoms of anxiety. We also have emotional symptoms like you are worrying too much, you keep on worrying, fearing too much, you have a lot of fear, and also irritability. You get angry so quickly. You are beating your children, if you have children, at home, punishing them for nothing, even exaggerating punishments. And then later you realize that because you are anxious. Irritability is an emotional symptom of anxiety. We also have psychological symptoms like phobia. If you have phobias like phobias of height or phobias of traveling with a car or darkness. This time that you have anxiety, these phobias, they are exaggerated, they are too much. You can even faint because of that phobia. We also have other symptoms like environmental symptoms, or your life is affected. You're not able to perform normally. If at workplace, at school, anywhere, you're not able to perform normally. So the other one are behavioral symptoms. For example, isolation, withdrawal from people, procrastinating things, getting late at work, sometimes over punctuality. You're supposed to report at work at 9 or 10 a.m., but you report at 6 a.m. because of anxiety. Sometimes you may get too late. You forget deadlines. You forget things that you are already in the diary. Those are behavioral symptoms of anxiety. We also have cognitive symptoms of anxiety, like overthinking. Your mind is racing. Your brain is racing. You are overthinking. A simple comment that has been made by someone becomes a whole problem, in you. Yet they did not mean a lot, but you have taken it to be negative comment. You are taking it personal. You are overthinking. Also, confusion is a cognitive symptom of anxiety. You feel confused. You cannot concentrate. Even in class, you cannot concentrate, and all that. So even memory loss is another cognitive symptom of anxiety. Now, having said that, we need to look at how do you manage anxiety disorder. When you realize you already have the anxiety disorder, how do you manage anxiety disorder? Very important. Number one is what we call personal care or self-care. Self-care will involve things like exercise, jogging, running, journaling. Journaling is where you write down what you are feeling or the things that are in your life. And you can even write the positive things so that you try to distract your mind from the negative thinking. Journaling. All those are self-care. Even sleeping, you make sure that you have quality sleep or enough sleep, adequate sleep. You also ensure you have balanced diet. You eat well. Don't eat just before you go to sleep. Eat at the right time. Take enough water during the day. Make sure that you are taking balanced diet. That is self-care. But let's now come to second. The number two, which is very important, is the coping skills or relaxation techniques. And here, let me talk about mindfulness. Practicing mindfulness. What is mindfulness? Mindfulness, when we talk about practicing mindfulness, is where you do everything possible to shift your brain from the past and from the future. That is uncertainties. When we talk about past, we are talking about regrets. When we talk about future, we are talking about what ifs. So you shift your brain from the what ifs and from the regrets, and you focus your brain on the now, on the present. That is now. Okay, so anything you do to do that is what we call mindfulness. And I want to give you an example. Before I give you an example, let us discuss how does mindfulness work. Mindfulness, as we have said, it works by focusing your mind on the present and forgetting about the past and forgetting about the future, because you have no control about both. Because even if we may say that you can make better choices for your future, still it is uncertain how the outcomes are going to be like. So you now focus on the present, on the now. Let us have examples of how you practice mindfulness. You sit down the way I'm seated. For those who are watching the video, you can do that. And one thing is you use your 5 common senses. Because what you're trying to do is to shift your mind from the present, from the past, and also from the future worries. And you focus your mind on the now. One best is what we call the number one method of mindfulness is what we call the 5, 4, 3, 2, 1 method. You can close your eyes, for example, Or even before you close your eyes, you can say 5 things that you can see. What are 5 things you can see? For example, right now, I can see the camera, I can see the cameraman, I can see curtains, I can see lights, I can see myself, I can see the table. You look at 5 things that you can see. Then you come to your touch, your feeling with your hands. 4 things you can touch. For example, I can feel my phone, I can feel the seat, I can feel myself, I can feel the microphone. Those are 4. Then you come to your ears. 3 things you can hear. Right now, I can hear the faint sound of the air regulator. I can hear some birds. I can hear some vibration from my phone. So those are 3 things I can hear. You now come to 2. What are 2 things you can smell? Right now, what can I smell? I can smell maybe myself and also the air. So you look at 2 things you can smell. Then 1 thing you can taste. I can taste my tongue or my lips. 1 thing you can taste. So 5, 4, 3, 2, 1 method. You can also use the spiritual. You can go the spiritual way of trying to do the mindfulness. Like you can ask yourself 5 verses of the Bible I can remember in 30 seconds, or 5 promises of God I can remember in 20 seconds. You mention them, you say them. So you are trying to focus your mind on the present and shift it from the past and the future worries. Regrets, you focus from regrets and what ifs, and now you focus on the present. So any mindfulness technique that is going to work. We also have the mind grounding. For example, you can count 100 to 0 backwards. 199, 19, 97, 96, 95, 93, 92, 91. So your concentration is now on what you are doing. So your mind is going to shift from the past and the worries that you have. So when you talk about coping skills and relaxation techniques, mindfulness is one of the best coping skill or relaxation technique that can help you manage anxiety. Now, so far we have said to manage anxiety, you need to take self-care. And then number 2, we have said mindfulness. And also now, we also have something else. Spiritual intervention or spiritual method. That is where you pray, you meditate on the word of God. Actually, I have witnessed and I have come to see so many people have been able to manage anxiety on their own by learning the secret of deep prayer, where you do deep meditation, deep prayer, where it is now you and God. Faith plays a very important role in anxiety management. So the other thing is where you can seek support. You can seek support from maybe support groups, a friend, a family member, someone who is close to you, someone who can listen to you or understand your worries or what you are going through. And sometimes it is also important to consider professional help. You can seek therapy or counseling from a professional that are going to help you, maybe even do the relaxation techniques, the coping skills. They are going to help you see which is the best coping skill for you, because different mindfulness techniques, different relaxation techniques work differently with different people. So that's why it is important also for you to see a professional. Also, a professional can help you know whether your anxiety disorder is environmental or it is genetic. Because when it is genetic, sometimes it is important also to use drugs, to use medication. You can be sent maybe to a psychiatrist who can help you manage your anxiety through therapy, or that is talk therapy, also through drugs, and also through other lifestyle habits or skills that you are going to be proposed. So it is important for you to consider also counseling and sometimes also medication, as I have said. Having said all that, let me say anxiety is something that you have no choice but to manage it. We have seen so many people because there are so many effects of anxiety. Why should you manage anxiety? Let me talk about that before we finish. Why should you manage anxiety? It's because, number one, anxiety disorder can affect you physically. Physical health yako. It can lead you to depression. Anxiety disorder can lead you also to even thinking of suicidal thoughts. And also, remember, now that brain chemicals are not balanced, you may find that your immunity will go down. So you start contracting some sicknesses that are weird, or even the common sicknesses like common cold, but they become so frequent because of anxiety. Also, it can affect you in other areas like emotional and psychological. You find yourself, you're not able to sleep, you're not able to rest, your mind is always stressed, and because of that, even you're not able to visualize a hopeful future. You can even find yourself stopping to continue. You can even find yourself quitting your job, quitting your work, quitting your ministry. So you lose opportunities in life. You don't attend interviews. You don't apply for jobs. You don't apply for promotion. You become desperate. And at the end of the day, you can lose a lot because of anxiety disorder. That's why you need to manage your anxiety. Again, what will be the benefit? What will it benefit you to live a life that has no peace? You are not happy. Every day you are worrying, every other hour. And something so tiring in this life is when you cannot manage your anxiety. Ask people who have been struggling with anxiety issues and disorder. They even wish themselves dead. That's why you need to manage it so that you regain your peace of mind and you're able to run your life in the normal way. If you have any question, you can type, you can comment in the comment section. I am Counselor Dego Steve GM, and I can help you in whichever question you may have concerning anxiety. God bless you.